Hello, I'm Roger Faulkner, the inventor of the Conformal vest ventilator. I myself live on 24/7 ventilation, so I came at this with an insider's perspective. I invented the Conformal vest ventilator for my own needs, which are not met by current ventilators. These patent drawings show the conformal vest ventilator, which is quite different than any other ventilator on the market today. The lungs are pulled out by a shape change in the vest itself. Contact is maintained between the vest and the skin with a mild vacuum. When the anisotropic tubes embedded in the vest lengthen, the vest expands. This will be the first fully portable negative pressure ventilator. Ventilator market is growing around 7% before COVID, probably faster now. Our initial market will be portable ventilators. Whenever those are used for severe medical conditions, they're definitely FDA regulated. The initial target market includes COPD, of which there are 2 million severe cases in the U.S. We estimate severe asthma cases are also several million. And neurological diseases and paralysis contribute another million cases. Our device can also be used in the hospital or by paramedics. FDA has already given an opinion that our device is not going to be FDA regulated if it is used for health and wellness applications, and this includes subclinical COPD and asthma and cases of COVID-19 lung damage. Wearing the vest would improve life of those people, and that's a new market. Our main target markets will be FDA regulated. We are using the trademark Ventilator MV for those markets. Severe COPD is one example of an ambulatory type of market. A large potential market is for sleep apnea. Sleep apnea affects 26% of all adults in America. And this is a case where patient compliance is a severe problem. We think the conformal vest ventilator will be better accepted because it doesn't involve anything sticking in the face at night. And this is a severe condition. Carrie Fisher, for example, died of sleep apnea. We know now that there will be long-term effects from COVID-19 infection. Some of those cases are subclinical, and many of them will be clinical. For the clinical cases, FDA regulation will be required. There are many patients with neurological diseases, such as my own, that require full-time ventilation. Our device will allow them to be able to have a normal conversation. Diaphragmatic paralysis from auto injuries and war injuries is also a major contributor, something that can be helped with the FDA Class II Ventilator MV. The ventilator will also be helpful in emergency situations where intubating a patient is going to be quite difficult, like in war or in a car accident. There are also FDA non-regulated applications for which we will use the trademark Ventilator EX. This gives us a way to begin testing of our device prior to entering under FDA supervision. Some of the markets this may be useful for include mild COPD, where people are simply out of breath. Similarly with asthma, athletes may be able to improve their training by pushing their muscles harder because they don't have to worry about the breathing effort. That's particularly true of people that have compromised breathing. It's also possible that the conformal vest ventilator can be used for increasing lung capacity in elite aerobic sports athletes. Nearly all ventilators that are used in America today are positive pressure ventilators. That means that air is blown into the lungs as opposed to sucked in like it is in a negative pressure ventilator. Anytime you're blowing air into the lungs, you have to have something sticking in the mouth or the nose or covering both the mouth and the nose. This interferes with eating, breathing, and speech. It also affects social communication. These devices that blow air into the lungs are always a risk for infection. And surgical tracheostomies have many medical complications leading to death. Avoiding a tracheostomy is something that anyone with the alternative would prefer. The conformal vest ventilator is the only negative pressure ventilator which is form-fitting and goes around the body. There's nothing sticking in the face. It will allow normal eating, breathing, and speech. Avoiding tubes means no additional infection risk. It avoids tracheostomy, which is something anyone would want to avoid. In addition to the iron lung, which is a negative pressure ventilator, there are other types of negative pressure ventilators. The prior art on this is what's called a cuirass ventilator. On the left is a fully commercial cuirass ventilator from Hayek Medical, which is FDA approved. As you can see, you can't walk around with this device and can't wear your clothing over this device. That's from Hayek Medical. The one on the right is the Right Air AD cuirass. These are the only two products that are either on the market or being developed for marketing. In the case of the Hayek medical device, it was first patented in 1997. It has a limited market in the US, but a bigger market in Europe. The Right Air cuirass ventilator is lower profile than the Hayek medical cuirass ventilator. That means there's a smaller volume of air that has to be compressed and decompressed each cycle, which means lower energy consumption, so that the Air AD will be portable. Certainly more portable than the BCV. However, Air AD has not even begun their FDA clearance process. Quick comparison of cuirass ventilators in general versus the conformal vest ventilator. A cuirass ventilator has a rigid shell which does not move with the body. This makes it difficult to seal leakage, especially along the sides, and it interferes with motion, bending over or twisting motions in particular. There's a large volume of air under the cuirass, and changing that pressure means high energy consumption, which in turn means that if you're going to make it portable, you need a big battery. In fact, the Hayek medical device is not portable in that sense. It has to be plugged in. Cuirass ventilators are visually obtrusive. They can't be hidden. And the cuirass ventilator prevents laying a patient on his stomach in the ICU as is desirable for cases of acute respiratory distress syndrome. The conformal vest ventilator can be worn under the clothing. Its flexible nature makes it easier to seal the vacuum under the vest. It better enables movement and exercise, and it will allow proning in the ICU. The high energy efficiency due to the hydraulic drive of the vest ventilator will enable a 24-hour battery life, which is pretty important for mobility. This animation may help you understand better how the conformal vest ventilator works. The tubes get longer, and as they do, they pull the chest out. This is essentially similar to the way the diaphragm muscle pulls the lungs down during ordinary breathing. Exhalation occurs because of the contraction of the elastomeric tubes. Arguably, the closest prior art device to our device is Right Air's Air AD cuirass ventilator. Right Air is targeting severe COPD patients. It uses a rigid cuirass which limits motion. Although its cuirass is smaller than the Hayek Medical BCV, so it is portable with about a 7-hour battery life. Hayek Medical doesn't seem to think this is a serious competitor. Chronic obstructive pulmonary disease used to be called emphysema. There are 16 million cases in the U.S., of which 2 million of those people can barely walk around without getting winded. There is a large potential to reduce hospitalization costs by enabling these people to exercise more. There are many mild cases of COPD as well as asthma, which could be addressed using the non-regulated form of our ventilator. A bit more detail on how the conformal vest ventilator works. The element that actually makes the vest deform are parallel anisotropic inflatable tubes which cover the front of the vest. When these tubes are inflated, they get longer but not fatter. That drives inhalation. Hydraulic fluid is used to drive the inhalation, which is much more energy efficient compared to the air driving mechanism of a QRS ventilator. The energy efficiency of the conformal vest ventilator is better than any prior design, which means longer battery life. We think this device can have a 24-hour battery. It can be worn under clothing. The version shown here has shoulder straps, which allows for vigorous exercise. We filed our international PCT patent application on December 4th of 2020. We filed our FDAQ submission on October 1st and wrapped it up on December 17th of 2020. Our prototype development is underway. I also gave a TEDx talk called The Power of Invention, which will be released by TED fairly soon, we estimate in February. We have a great team of advisors, and we're seeking seed investment. This animation shows the breathing deformation of an anisotropic tube of our invention. I am a polymer scientist, and this is a polymer play. I understand these tubes and how to make them very well. In this particular case, we created a prototype from off-the-shelf silicone tubing with bonded helically wound fibers, which is okay for the prototype stage. In the future, we can use lower cost tubing based on thermoplastic elastomers. Our intellectual property covers this unique ventilator vest, which expands to drive inhalation. We also have IP on the anisotropic fiber reinforced tubes, which are the basis for this motion. We have covered both mild vacuum and adhesives to create the connection between the vest and the body. Our intellectual property also includes methods to actually create the anisotropic tubes. The ability to actuate breathing using a hydraulic actuation method results in lower energy consumption. That means a longer time between needing to recharge the battery. We are currently seeking $240,000 for approximately 1 year of operation. We've already filed the PCT patent application. We're in the midst of developing a functional prototype. The functional prototype will make this process accelerate dramatically. We will apply for de novo clearance under FDA as soon as we have the functional prototype. And we can begin testing for athletic training application. In year 2, we need more money, and we will have an FDA-approved test plan. We will complete the mechanical testing part, and we will begin the clinical testing part. We will launch the athletic training market. In year 4, the national phase patents will be filed. We will gain FDA Class 2 approval for at least one application, and we will have defined the manufacturing and supply chain. We're aiming for acquisition, licensing, or strategic partnership by the year 4. By then, we will have multiple FDA Class II device approvals. We will clear medical device reimbursement with the payers. I am the leader of the founding team. I am the inventor, and the inventor of not just the vest, but the anisotropic tubes which underlie the vest. I have a lot of experience as technical director as well as vice president for research and development for a series of companies. My brother Robert is our medical director and co-inventor of the. He's a medical doctor specializing in emergency room medicine. Jake Wenzel is the CIO and corporate secretary and has been instrumental in writing the patent and many other things we've done. Terrence Fagan is a professor of mechanical engineering who is a board member and is my designated successor in case my ALS takes me early. Colin Felton is a PhD chemical engineer, member of the board of directors, with long experience in the fiber composite field. We have an amazing team of advisors. Neil McIntyre, professor of pulmonology at Duke. Jason Bates, professor of biomedical engineering at Vermont. And he has specific experience with development of ventilators. Miriam Davins, MD, is also on our team. She has a lot of experience with it. HHS, Jay Rubino was formerly business development for North America for Hayek Medical, which is in a way our closest competitor. In conclusion, I have developed a new ventilator that will revolutionize the industry. I'm currently looking for seed investment to get the ball rolling on something which will ultimately be worth hundreds of millions of dollars. Thank you for your time and attention. Hayek Medical, which is in a way our closest competitor. Okay. I think you might be able to work with that anyway.